You
Good
know,
morning, Kelly. Thank you for joining on short notice.
Good
so
morning.
I'm
Thanks for
just,
the invite.
oh, sorry. If you're being promoted to panelist, that just means we're gonna see your video or your name, whatever you choose to share. It's not that we're asking you to talk. So if you are being promoted to panelist,
Don't get nervous.
you don't decline but because you're nervous. If you are declining, you can tell me why and I can help you. Okay. Lindsay, I think I can rename you, maybe. I might,
So Lindsay said she just
you
didn't
do
have
not.
a camera. So
Okay. Okay. If you can rename yourself, that'd be awesome. But if you cannot, no problem. We can figure it out.
Hey guys, it's
Jackie, it's
Tara.
so good to put a face to a name.
Let's get going, guys. Everybody that's not Michelle Black or is Michelle Black, how about we all put our names, including me, in the chat? I would feel much better to understand exactly who's here. So, you guys, put your name, put your hospital, please. And then if you have received your cuff kits, just put yes, received cuff kit or no, have not received cuff kit. We are tracking that closely and really appreciate that intel this morning. I think that I know most everybody as I try to type and talk at the same time. That's not easy to do. Um, I think I know everybody on the call, and we are going to spend some more time together in the coming months getting to know each other even more, especially surrounding this pilot project. But a massive thank you for joining us so early in the morning on a Tuesday. It's kind of Monday squared. And so we want to jump in. We know that you guys are busy folks, but again, we really appreciate A, your enrollment and interest in this extraordinarily important project, B, that you're willing to meet and get kickstarted here. Um, let's go to the next slide, please. Yep, there it is again. Just make sure that your name's in the chat. Are sorry that we're all named the great Michelle Black. Actually, we should have added some additional words to that. It's true. But again, we're watching the chat to make sure we know who's there. If you come off mute, which we would love with questions, just introduce yourself just to make sure that we have a name with a face. And again, if you haven't already put, if you've received your cuff kits in the mail, let us know there. So you guys, this is the Kansas Cuff Pilot Project, an additional or extraordinarily important piece of the severe hypertension and pregnancy safety bundle. We are thrilled after 2 years of work that we're going to kick this off, and your hospitals have been chosen for a very important reason. So today we're going to go through real quick the resources available to you, the faces that are here to help you, and what's available online to assist your hospital in getting this project going. Next slide. All of you should have seen this already, but the following slides we're going to roll through them real quick. You will get this slide deck at the end of this session. I think it's extraordinarily important for you all to understand what's going on with this project, the severe hypertensive project, but specifically around blood pressures. And again, I know that seems simplistic and perhaps remedial, but really honestly, taking the blood pressure accurately both in the clinic and at home is a very important piece. And we'll talk about that again in a minute. But the preceding slides really just provide resources. I picture hospitals, clinics, and certainly at meetings, that these would be on a slide deck that you could present to explain your project. You could put it on a bulletin board. However you want to share it out is fine with us, but that way folks know what the heck's going on. So again, the Cuff Project isn't just about this pilot project. It's about education, specifically post-birth. It's about resource development and dissemination, and it's about you guys doing the pilot project and putting cuffs in hands. Next slide. Again, this is data for you to share out. Just reminds us about the extraordinarily important and uncomfortable data surrounding hypertensive disease in Kansas amongst our delivering population. Next slide. And again, another why. We know that preeclampsia significantly increased in the years 2016 to 2023. It continues to increase. Again, we're just giving you data for why. Next slide. And so why did we choose the hypertensive bundle? Seems obvious, but we wanted to fix the problem. Next slide. And we know it takes all these people. Again, those of all of you are enrolled in our bundle and know that that we talk a lot about the community of care, the circle of care, and in the Cuff project, that is no different than everything else. We know it takes more than just the patient, more than just the provider. It takes an entire group to make a better outcome. Next slide. And then I wanted to include this slide because I think of all of the slides, of all of the resources, this picture to me makes sense for both patient, provider, triage, everybody that's involved. And it really talks about the pieces that are important in this bundle. So again, please copy, disseminate, send it an email, put it on your Facebook, do all the things to make sure everybody understands blood pressure to treatment, no matter if she gets transferred or is discharged, has to funnel through a constant continuum of care. Next slide. Also, what I don't want to lose sight of, and I want to make sure we stop and pause on this, and I'm preaching to the choir, I realize that. But remember that the piece that's important with the pilot project is that the patient is helping us identify the problem so we can more quickly and accurately treat or reassure, right? We know that in our KMMRC data, we certainly know from anecdotal evidence, and we certainly see in the vital statistics report that we have more patients with hypertensive disorders, and yet we're finding morbidity still climbing. Mortality might be better, but morbidity is still climbing. So our goal there is to get the blood pressure assessed, get her to treatment if needed. And once she gets to us, we accurately respond, right? Timely treatment, less than 60 minutes with severe range pressures. So the Cuff project, the pilot project feeds into that by putting the patient in the driver's seat. Next slide. This is a breakdown of that previous slide. I think it's important for everybody to understand, again, all the pieces of the bundle. We just keep showing this to you. I really hope that everybody begins to understand how important all the pieces of inpatient, outpatient, community care are connected, and that's what this slide entails. Next slide. And then this is your specific work. If I was gonna pick a picture to describe the Cuff project specifically, the pilot project specifically, this would be it. We start at the left-hand side, and Stephanie Wolf is going to talk some more about these resources and what we can provide to all providers and patients alike. We talk about early access to OB care. We talk about aspirin for prevention. We talk about post-birth education. We talk about childbirth education, becoming a mom, et cetera. But we're also identifying very early and continuously the need for home blood pressure monitoring. Next, we're going to put that in your shoes. We're going to put that blood pressure cuff in your storage compartment and say, whenever your providers feel there's a need, identified need, boom, patient gets assigned a blood pressure cuff. She's told by your office or somebody how to take accurately a blood pressure. She's educated on post birth, and she's educated on how to follow up with an abnormal reading. That piece is your decision, your protocol. We have lots of resources to help, and we'll show those to you. But that's where you take over on the pilot project. Increased maternal fetal surveillance is part of that. Again, that's the protocol piece. And are we paying attention to her SSDOH needs? What are the other screenings? What are the referrals she needs? We know that mental health is often an important part of severe hypertensive disorder. And how many other people do we need? Oftentimes, we need OB navigation in this moment for our higher risk patients, and certainly we want to grab them in. And then there's the timely treatment moment. That last box talks about she needs to know when to access care, meaning elevate care with an abnormal reading. The minute she hits, if she's got two abnormal blood pressures, you know the rules. We need to timely treat within 60 minutes. And we're watching our hospitals improve this dramatically. So get her educated, get her a cuff. That's you guys' work. We're going to prove in this state that this is piece of the puzzle and get her to the hospitals, and then you guys know what to do next. We deliver, or we transfer, or we follow up in the antepartum setting, and then what happens next to keep her healthy as well as her baby healthy. Next slide. So kicked off yesterday officially. We know not everybody has their cuffs. We know that it's a warm um, start, and we want to be helpful in that moment. But know that it's a 6-month project. We're going fast and furious because we want to get these cuffs out. We know that this is an outcome changer in a good way. So we're off and running. Next slide. The distribution of the cuffs is really, again, a decision for your provider group. Certainly aided and assisted by resources like I mentioned, and we'll show you in a second. Qualifying condition. Please don't give cuffs to every pregnant patient. While that is a great goal, for right now, we need them to have qualifying conditions, and we'll show those in a minute. We need you to internally track. We're not asking you to keep patient identifiers. We're not asking you to send those to us, but you need to track, and we'll show you why here in a minute. And then what is the data collection piece? We've made it very simple. We understand we ask for a lot of data, and we also know that that hinders involvement in our projects. And so we try to really make that very simple but meaningful. And again, we'll show you that in a second. Next slide. Qualifying conditions for patient selection. Again, you will get these slides. Here are the conditions that we recommend that your providers use for dissemination of the pilot project cuffs. Okay, I'm not going to read them to you. You can look at them after the presentation, but seems pretty obvious. Next slide. And then this is the internal tracking. Remember, if you look at that second bullet point and the box that's there, this is the data we're going to ask you for. What percentage of these diagnoses did you provide a cuff for a patient? The total should equal 100%. So at the end of the project, we're going to say, hey, remember those qualifying conditions also listed here on the boxes? What percentage of patients that you disseminated to him had those qualifiers? We have templates. Michelle did a great job of showing you a snapshot of that at the top. Again, this is only for your records. You might have a better system that you'd prefer. You might have an Epic option that you're using as an example of EHR use. But we're asking you to track so we can find out the answers to that bottom box. Next slide. Data collection evaluation. So the surveys that we're going to send you at the end, and actually you have them already, including the pieces that she's showing you. There are 3 pieces of this: the hospital piece, the clinic provider piece, and a community partner survey. Okay, so depending on your piece of this project, in other words, who you're representing, our champions, for example, you will get that survey. The clinic provider will get a survey. We'd like to hear their feedback in terms of what their decision making was and how it went. And then the community partner, of course, and we're talking on the outpatient side, certainly on the KDHE side. And Stephanie, again, will discuss that here in a second. Next slide. Then we have a patient side. We are aware that not every hospital is able to provide this to patients or has a streamlined or approved way to do so, but we would love to hear from as many patients as possible their version of this pilot project. And so again, we will send you a QR link. I believe that there's a QR link here in the slide deck, and the survey to the patient. So actually there are 4 pieces, right? We'll call it internal side, and then the patient side that asks them, hey, what'd you think? How'd this go on your side? Next slide. Bingo, there it is. Actually, that's not
Wait,
true. That's the toolkit
no.
piece. I'm sorry. Stephanie, this is your turn. And then as Michelle mentioned, we'll come back to it, you guys. All of these resources will come to you again at the end of our session today. They are also on the Kansas PQC website, and we'll send that specific. I think it's actually right there at the bottom link. But you will have easy access to all of these resources at your disposal. All right, Stephanie, introduce yourself and let's do it.
Right. Good morning. I'm Stephanie Wolf. I'm the clinical perinatal and infant health consultant here at KDHE. So I'm helping to support the educational resources as well as the community partner who's going to help support you in, assuring that the
Oh,
participants of
sorry.
this, you're okay, of this project, receive and understand the education component to it. So, there is the QR code to the online perinatal hypertension toolkit where all of the educational resources that I'm going to just cover very briefly today are located for your access to review, print, provide as handouts. We will be disseminating in the coming weeks the laminated version. So it's very similar in style to the, maternal warning signs education guides that we provided a couple of years ago. So those are at the printer right now, but you all will be receiving those, as well as we will be targeting the outpatient clinical providers as well to get those in their hands as well. So next slide, please. This is the cover page of the education guide for the perinatal hypertension component. So this is a supplement to maternal warning signs, if you want to think of it that way. Within this guide, there are resources for both providers, educational resources for the providers, as well as for provider use with patient education. It covers measuring for correct cuff size, selecting a validated cuff for use in pregnancy, taking an accurate blood pressure reading, as we have learned that there's a lot of staff that don't accurately take blood pressure readings. So there's information in there, obtaining blood pressure cuff through Medicaid, how to navigate that outside of the cuffs that will be issued to you as part of this pilot. The preeclampsia risk workflow document I'll show here in just a moment. There's the check no share log. You'll see in just a moment as well. Preeclampsia and pregnancy and postpartum educational resources on that, low dose aspirin, and heart health after pregnancy. So it covers the whole gamut. So just be assured that you will have all of those educational resources. We will be covering those much more in depth in our monthly check-ins. For today, we just want to let you know that we have the resources developed and they're available to you. Next slide. This is the preeclampsia risk workflow document. So this is in that guide as well as online in the toolkit. We were very intentional. I worked closely with Tara to make sure that this workflow really covered from the beginning with universal education of all staff to universal education of all patients on maternal warning signs, as well as risk of preeclampsia, to identification of those patients who qualify for a cuff, receipt of the cuff. The blue boxes cover education or steps that all partners will utilize. So depending whether you're in a birth facility in an outpatient clinical setting, or you're one of our community partners who's helping to reinforce, everyone will go through those steps, and then it breaks out whether you're a clinical provider or a community partner as to your next steps in the light blue and the green box. So that goes all the way through on the first page, from the universal education to identifying those who qualify for a cuff. And then on the second page, it walks through, once they qualify for a cuff and participation, the steps that are involved there. And then the yellow box separates into the postpartum period and that additional follow-up and the steps that will occur after that. Within each of these boxes, there are the educational resources are identified by name, and they have a number. Each within the laminated guide, those resources will have a numbered tab, so you can navigate to them very quickly based on the identification within the step that you're in. So I know it's a lot right now. Again, we're going to dissect this more in the monthly check-in calls, but just wanted you to know that this is kind of your go-to resource, this workflow document for identification of all of the steps and all of the resources you will be utilizing. Next slide. And you can go ahead and click, Brittany, 2 more times for the animation. So just wanted to call attention to the maternal warning signs education guides that you all should be utilizing, just as a reminder that these should continue to be used. We aren't abandoning those and moving on to the new guide. They're to be used together. As the data shows, we need to be educating on maternal warning signs. So this is just a reminder of that, and just want to call out that we will be disseminating these guides to outpatient clinical providers as well. We did not do so in our first round or our first phase of the launch, but we do have those coming, and again, will be being disseminated in the upcoming weeks as soon as we receive them. So know that your outpatient clinical providers will be providing the same education, utilizing the same resources. So we have that clear, consistent, repeat messaging across the sectors. Next slide. And Tara, back to you.
Hit the button, hit the button. Hey guys. So what's in the cuff kit? This is a picture. Michelle did a great photographic evaluation of everything that comes in each kit, guys. So look at that. What an awesome Christmas present. Ta-da! See how I did that? I've got a lot of questions from some folks about what exactly comes with it. That's a legit question because if you're handing stuff to patients that has different information than you're providing to them, no good. Preeclampsia Foundation did a phenomenal job. And so there's the visual. You will notice that it also has the bracelet was still at risk. Man, if we could disseminate those across the state, that'd be pretty cool. So your patients get them. Again, I think there's a sell to this too, and I would tell you that as a provider, it's partly my job to explain to the patient exactly how this should go, but also to tell her we want to help. This is a gift. Take it and let's make you healthier. So there's the kits. Next slide. Then mark this on your calendar. I also am sure we'll all get calendar invites with the links. We're going to plan to meet monthly. You may not need that moment, but we would love to meet. We'd love to discuss challenges and successes with you all. Of course, in between, if you have questions, concerns, or a what if thing that occurs, don't wait until the office hours. Please just reach out to all of us. You'll see our contacts again at the end if you don't already have them. But we're excited to make sure that we chase and follow each other through this next 6 months. Next slide. And then there's our contact information. We've got about 7 minutes left on the call. Certainly can make it over that a little bit if you need to, but we would love to hear questions from you all. A lot of information. Biggest issue is put the cuffs in hands with education and follow-up. Resources galore. But what questions do you have? Jump off the mic or type them in the chat.
Hi, this is Becky. I had trouble hearing, but are there different sizes cuffs? I haven't opened my boxes yet, or is there just one size
Sarah, would you
cuff?
like me to answer that one? Yes, and we shipped out based on the formula recommended by Preeclampsia Foundation. So you will be receiving 70% large cuffs and 30% extra large cuffs. And so every facility we took what your birth numbers were and then a percentage, of our entire cuff kits. And then your facility will get, some extra large and some large.
When we talk about I specifically thought about the maternal warning signs education guides that are coming out. I specifically also thought about we've got two providers now delivering that are hours in the hospital, two independent outside of the hospital. What would that also be something that we could provide to our EMS, our ED, and our convenient care?
You just knew how to make me happy today, didn't you, Jackie? Yes, the
Yesterday
answer
and
is
today,
yes.
2 days
I
in a
know.
row, Tara.
Jackie,
I'm a
you
little
win.
scared what I'm going to do tomorrow.
Slow down. Uh, guys, Jackie sent me her IPV protocol and I fell out of my chair. Wow. So yes, the answer is yes. In fact, how can we help you? So let's get things going, um, from training to resources to more gear. The answer is yes. Also, Jill just mentioned the third thing I was going to talk about. Yes, post-birth training. I think we've gotten so far into post-birth training that some of us forget that not everybody knows that acronym to red and yellow flag. Please share that out with your EMS, ED staff, anybody. But yeah, definitely would love to have you correspond with those guys. They are your first access timely treatment moment, aren't they?
Sort of helps when you have a daughter who's an EMT going to paramedic school, and
Shocking.
another daughter who's a nurse prac who gets to see some of our prenatal patients. So
I love it.
Use your resources.
That's a
those
community of
are my
care right there.
resources.
Yeah, great. Thanks, Jackie. Anybody else with questions?
I
While
think
I have you
this,
here, oh,
oh,
go ahead, Kelly.
sorry.
Go ahead.
This is awesome. You guys have provided us with so many resources. I am going to try and get in front of my providers who I have, I think, 4 different practices who are going to be piloting this with us. What resources would you recommend for me when I sit down with them?
Yeah.
You know,
Yeah. Make
I'm
it
not going to
simple.
have a lot of time with them. So just to
Yeah.
give them like,
The sell. You're going to
yeah,
sell it, Kelly. All right.
yeah.
So if you're coming to me as a provider, let me give you what I'd need. I want to see it. I want to see the cuff kit, right? Lay it out. Um, I want to know the patient qualifiers. So I would pull out that slide or that list, and I would want you to describe exactly how this is going to go. So to me, it's the action plan, but you sell it, Kelly, in your world, however that looks best. So in other words, I would give them a case study. Patient A comes in to the clinic. Here's what's identified. She's at risk. You give her a cuff kit. We got to track that internally. Here's what I'd recommend we do. She gets the cuff kit. She knows the follow up. How is she reporting back? Right? Is it a blood pressure log that we provided on the cuff kit? Is it some other version? And then what are we doing to get her into care? In other words, does she know to come? Because Kelly, you guys are nailing when she gets there. So, and I would sell that. Providers want to hear something good, right? So they want to hear we're ready for her. This is just getting to her to us sooner, meaning
Mhm.
improving outcomes better. But I would make it real simple. And to me, it's an algorithm. That's how we speak, right? Providers talking algorithms. So it's like we start with this, we identify her here, and here's actually what we're giving. They
And
also may say, I may not know, but I want my nurses to understand how to do this. And so if the answer is yes, and now train our outpatient nursing staff or whatever for triage, you bet we can
And
do that.
Kelly, I would be more than happy to chat with you on the side too, because we rolled this out at Advent Health Shawnee Mission, also a large facility with a lot of providers that were not hospital owned. So I'd be more than happy to chat with you about how we tracked it, how we um, made the determinations, et cetera, et cetera. So
Yeah,
if you need to chat more, I'd be more than happy to do that with you.
that'd be great. Thank you.
And I'll just make mention that the laminated guides, both the maternal warning signs for the outpatient providers as well as the perinatal hypertension guides, which are new to everyone. I've been told by our state printer that those should be available by the end of next week. We're disseminating them by our community partners, like in person, to make that contact. But we can send them to you all in the mail. I think that makes sense for those that are participating as part of the project to get them in your hands more quickly. If you think that works, Jill, unless your in person is going to be occurring pretty quickly.
We had to pivot from the in-person, so we can talk more about that stuff for sure.
Okay.
Out.
Okay, yeah, because I want to get those in your hands as quickly as possible so you can have those in hand as you're covering everything.
And then should I have received my blood pressure cuff kits
No,
already? Or
I
okay.
haven't. And I was just going to say, Kelly, I will check in with you after we're done with this meeting to talk with you about shipment. So I know
Okay.
you've confirmed your address, but I'll reach out to you
Okay.
and we'll
Thank you.
confirm that this morning, okay?
Perfect.
That's one of the things I was going to ask. Becky, have you received your cuffs? Okay. And Jackie, have you received your cuffs?
Yep,
Okay.
they're right over there on my counter, and I've already had staff in here. We already had to open one because we can't wait till Christmas. So we've
Yeah,
already opened one just so we could see what was in there.
and Jackie, since you have opened one, can you tell me, do you remember when you opened it, did it have um the magnet?
Yes.
Okay. I wasn't quite clear on that, whether the picture I pulled had everything still in it.
Yeah, I
So,
think it did because one of the nurses um, that opened it was like, "What is this? Oh, this is," and then she realized it was a magnet, kind of like our post-birth magnets and
yes.
breastfeeding magnet. We have magnets, so we'll cover your entire refrigerator if you want us to.
Right.
So,
Okay. Thank you for confirming that.
You should ask Brittany about post-birth. How many magnets did you get, Brittany?
Oh, so many with my first and second kid. It was great. Yeah, I have a lot.
All right, you guys. Any other questions? And again, a huge thank you. I can hear your excitement and appreciate that it's a big lift. I think we're going to see outcomes change, and I think we're going to do a really great job in Kansas of getting more cuffs in hands very quickly. But you guys are the champions, so keep us posted on what you need. We will see you with our next, almost called a learning forum. Now that would be confusing. Our next office hours, and don't hesitate to reach out before that. You guys have a great day. Thank you so much.
Tara,
Happy holidays.
Yes.
uh, I asked Lindsay to stay on,
Okay.
but she said her computer is a bit ancient. I don't have a camera or a microphone. Can she call me directly? So do you see her phone number in there? Here, I can give it to you if you have a pen.
Tell me what we need to do. What's going on?
Um, so did you see the email
I'm gonna
yesterday?
stop recording.
Oh,
Yeah,
thank you, Brittany.
that'd be great.